Good afternoon, everyone. This is Tiffany Wilson, and as Jason mentioned a few minutes ago, when people are dialing in, if you could please go ahead and put your phone on mute, we would appreciate it. This is an audio-only webinar, but we will be posting video at a later date. I wanted to thank you for joining us here today for the first of our Medtech Women at SEMDA webinar series. As I mentioned, I'm Tiffany Wilson. I'm the CEO of the Global Center for Medical Innovation and founder and chair of Medtech Women at SEMDA. I'm excited to be leading the discussion today, and especially want to thank Halyard Health for hosting us. As I mentioned, this is our first webinar in a series that will continue throughout the year. We'll soon be sharing information on Medtech Women at SEMDA annual conference also later this year. And I want to remind everyone that the SEMDA Medtech conference is coming up right around the corner, May 2nd through the 4th in Greenville, South Carolina. This is the second time that we've moved it out of Atlanta, and we're really excited about the program and hope you can join us there. So today I'm thrilled to be speaking with Lisa Kudlacz, who is the Vice President and General Manager of Global Interventional Pain Management at Halyard Health here in Atlanta. I made it.
It's a wordful, yeah, mouthful.
And in 2017, Lisa was also named our first Medtech Woman of the Year. So thank you for joining us today and for hosting us here at Halyard.
Thank you for having me. I appreciate that.
So I want to kind of kick off. You've got a robust, experienced career in the medtech, and you've been with this organization for a long time.
Yeah.
Can you talk to me a little bit about your career path in the medtech industry?
Yeah, I started in sales, sadly 26 years ago, all in healthcare with Kimberly Clark and now Halyard. And during that time, held 13 different positions. Lots of experience in sales, but then went into corporate accounts and then did some development work in our custom procedural trade business, and have over the last 6 years have been running our interventional pain business here at Halyard.
And so 26 years, I'm sure you've seen a lot of changes, and I feel like we're in this constant sea of change in healthcare and the medtech industry right now. What are some of the interesting trends that you've seen over your career, especially since you've worked so closely with your customers?
That's funny because I think the customer is what is going to change us for the future. Right now, I think healthcare is in kind of a flux. There is a battle between cost and really when you think about innovation, who's going to pay the ROI when you have a lot of competing factors in the marketplace with where site of services and who's going to pay for what, and physicians being kind of stuck with their past behaviors and what they've always done with new technologies really could replace some of what they've done, and that's scary.
That's a scary place to be.
It is. It's scary for them in that way, but it's also scary for how they're either employed now by hospitals, or they're having to own or become part of big groups in order to make it worthwhile being a physician. So their world is very, very different, and I think there's a lot of struggle around how to pay for the current innovations that we're trying to put forth, and I think that's interesting now. What I believe will come out of it all, I think your physicians will get settled into kind of their new world. But I think for us, it's going to be more consumer driven. Mm-hmm. The closeness to what the patient needs are and what their desires are, where they want to be treated, not just how they want to be treated, but where they're treated. I think they're going to lead a lot of that in the future. And so we have to think about, from an innovation standpoint, how can we get closer to understanding our patients and what their needs are? Because if you think about our deductible plans that we have today, they're very high deductible. You could almost consider it cash pay for the first 6 to 9 months of your insurance coverage for the year, and that means that consumers are going to have to make choices. And here we like to make choices, and we like to drive those choices. So if you can get at from, what the patient is looking for and how they want to be treated. I think that's going to be a big driver of the future, and how we need to maybe even start to, we've gotten close to the physician for innovation and what their needs are, but I think that we're going to have to do some shifting and get closer to the patient.
It sounds like that's going to be a huge shift just for the medtech industry in general, where, really over the last 25, 30 years, it's been so heavily physician focused, and medtech companies are organized around that. And the sales process, kind of given your rich background in sales and understanding of interacting with consumers, where do innovators go? How do we start to engage the consumer? What are the platforms that we go to get that? It's easy to develop our panel of KOLs, right?
Yeah.
And kind of work that doctor angle, but it sounds like it's just a whole new uncharted world.
Yeah, so that's true for those that are in R&D in the scientific community, but it's not true for your marketers. And so
talk about that.
Yeah,
because
one of the things I think is most successful is when and one of the reasons why I think we've been so successful in our business is that our teams work really, really close together. Mm-hmm. So our whole innovation team is tied into our business strategy, and that has been key. And part of that, besides being tied in and understanding at a very deep level, kind of strategically where we're trying to go, it's also that they've been tied in with our physicians and our KOLs. Mm-hmm. Well, on sidebar from that, marketing has been doing our own research around how does it, for us, it's how does a chronic pain patient deal with life? And we know that they're in pain on average 10 to 12 years. There's narcotic use that's going on. Their lives are disrupted pretty significantly. We did in-home interviews with a lot of these patients.
Oh, great, yeah.
Well, you find out some things, though, about how their life is spent, and it's on the couch, and they may have 2 computers.
Yeah.
And how they're managing through their day, and it can be lonely and isolating. And so one of the ways we found best to communicate with patients is on the internet. Mm-hmm. So we do a lot of paid search advertising, really educating patients on different options that they have for treatments. Mm-hmm. And so understanding that, and then being tied to our strategy, and our strategy being tied to our innovation team, and them understanding what we're learning, and they understand as much as we do, that's where I think the connection can happen. And I also think that's what is going to lead the success, when you can pull kind of those 3 pieces together. So, the business strategy with the physicians, of course, that's not, I don't think, going to completely change.
Right.
You have to do that. That they're still the care providers. And then pulling in the consumer, I think that's going to be real powerful for the future of innovation.
Was that a hard shift culturally to get kind of the innovation R&D folks aligned with marketing and strategy? And
so it wasn't hard. We did kind of a overhaul, if you will, when we went to Halyard. We were part of Kimberly-Clark, which was a consumer good company. Mm-hmm. And so really them understanding what was necessary for innovation and the amount that they spend on it was really pretty weak compared to other medtech companies. Yeah. Right. So when we transitioned to Halyard and we spun away, which is one of the reasons why we did so, we put new investments in our R&D team, new leadership in the R&D team. Mm-hmm. We hired a lot of incredibly talented people that. And one of the things we talked about in the interview process was how they could interact with the business, and they all had that desire. We looked at a lot of different big organizations to try and capture their talent, of course. And one of the things you found out is that they were really excited to come into an organization that they could be kind of a part of a solution, where they might have been at a very large company, and they had one project and it was to do this work, and half the time they didn't know how it connected to the big picture. It was just something they had to do. And so coming in and knowing that here's the issue that we're trying to solve, and putting your arms around it from a business perspective with the end goal that revenue is a piece of that,
Yeah.
but also about what the effect is on the patient at the end of the day.
Yeah.
Everyone wants to have a job that has purpose, right?
Yeah,
You
yeah.
want to, I mean, when you go, you want to know that you put your day in and it meant something.
Mm-hmm.
I think that's one of the reasons why I love what I do. But I think everyone feels that way. And so being able to bring these folks in and having them be part of the purpose
Yeah.
makes it all work really well.
Yeah.
So it's been a nice transition for sure.
And I want to get back to that team building and kind of starting from scratch in a minute. But, so as the innovation, kind of the nature is changing and we're getting more in touch with directly the patient, what are some of the barriers to adoption that you see? Reimbursement has always been a biggie, but as health plans change, as point of care change, as care teams shift around the patient, what do you see the challenges for these new technologies?
Just that,
Yeah.
really, right? So I think very expensive procedures and technologies that add cost are going to be a problem. I think that products that are valuable to a consumer that they can pay cash for, which we think is anywhere under $2,000 when you look at someone's health care spending account, that if you can make an impact on somebody's life for under that, most people are willing to spend that. Now, that's not in all geographies, of course, and it's not where I'd like to see it go, because I don't think that we should limit good healthcare solutions to just those that could afford it. And so we do have to bring the commercial payers along with this. How we're going to do that, I'm unsure. For us, this opioid crisis is making a big difference because commercial payers are going to have to take a look at what we're doing to our population. Right? Offering a $7 pill at the beginning when you're in pain instead of educating and giving other options to these patients because you don't want to pay for them. That's got to stop. And I think that there's some good political pressure that's going to move the needle a bit on that. But then in other disease states that are chronic, I think that's a challenge.
Yeah, when you really look at the demographics of where some of these chronic states are living, it's interesting. So over the past 26 years, as you've kind of accomplished all these amazing things, you've done it, and you happen to be a woman. Any unique challenges along the way?
A ton of unique challenges, right? So besides the fact that you're in a lot of meetings where you're the only female, and you get used to that, right? So for women in general that want to have a career and are ambitious, which is a dirty word, for women sometimes, but are ambitious and want to get ahead. You have all the responsibilities of the work that you need to do, but you also tend to have more responsibilities outside of the office. And that can be challenging because you can plan as much as you want. I'll have this child here between this job, and then I'll get married here, and you try to fit real life into a timeline for work. And that it just doesn't work that way, right? My kids are 7 years apart. They were supposed to be 2 years apart, right? My parents got ill, and I had to caretake 3 of them. And there's things along the way that are just difficult, and a lot of times that responsibility falls on you. And then on top of that, there is a feeling and that you have to do more. At work to get ahead.
You have to overperform?
Overperform, for sure. And whether that's real or perceived in your head, there's a bit probably of both. And because you have to prove yourself because you're different and you feel that way. So you when you pile all that on top of each other, the stress can be significant for people, for women. And those women that find balance early and understanding that everything's not going to be perfect and sometimes it's going to be a little messy, that'll help, right? But yeah, it's definitely life. life and work are a challenge.
Did you have mentors along the way that kind of helped you navigate all of those challenges?
Yes, I did, and then I had informal ones that I didn't know about. Right?
Okay. Yeah.
So I had formal mentors, mainly men, because I was in that kind of industry, and they were fantastic, really helping me move my career forward and giving me good advice, because they don't see it the same,
Right.
Which is so helpful. And then I had a champion. Our president of Kimberly-Clark was a champion behind the scenes, not formally mentoring me, but she did some things that were extremely helpful in the right times. And this is where I think finding a female mentor is powerful, in that women understand women's insecurities a bit and what we're trying to get to. And I was preparing for my first time in front of the board of directors at Kimberly-Clark.
Yep.
And I had lots and lots of people coming to tell me what I was supposed to say in this 10-minute presentation.
Oh, that's great.
Right?
Yeah.
And my head was spinning around.
Yeah.
And I'll never forget this, because I was like, well, they want me to say this and don't say this, and say this but don't say that.
Yeah.
And I'm just trying to do what I do best, which is to just
Do your job?
Do
Yeah.
my job.
Yeah.
Right. And Joanne came into my office and she said, hey, don't listen to everybody, just be you.
Yeah.
And I looked
Great
at her,
advice.
and it was the craziest thing, because I was like, are you in my head? How did you know?
Yeah.
But it was perfect timing when she said that, because I was like, yeah, because that's what I wanted to do.
Right.
But there was a lot of that insecurity. It's like, well, these guys have been in front of the board, so they all know what I shouldn't do, and shouldn't, and my confidence, my confidence was going away, and she came and just be you, and it was fantastic. And sometimes you just need that person that's been there and understands those insecurities to talk you off the ledge a little bit.
So what advice do you have for people younger in their career, earlier in their career, to find that mentor and kind of in a broad base? I mean, for me, I didn't grow up in a big Medtech company, and so I was a startup person, always worked in small companies, and so I didn't have experienced folks around me who I could just go, ask.
Yeah.
I had to develop a network kind of in the community from scratch.
Yeah, that's hard.
So what advice?
So for this,
yeah,
you have to join things like SEMDA and get involved.
Yeah.
Because here's women in Medtech that are here to do these things, and encourage your participation. I know you're busy and I know it's hard, but if you just step outside of your comfort zone and go, I always tell the ladies that I mentor, I give them a little assignments, and I'll say, so this week I want you to do one thing. I want you to go to a meeting, and I want you to sit at the same place all the men are sitting, and pretend like you're in charge. Just sit where they're sitting.
Yeah.
And then I want you to ask or say one thing with conviction during that meeting. Just one, not to hear yourself talk. You have to make sure that you're saying something that's relevant. And then I want you to write down after how that felt, how scared you were, what happened, what was the result.
Yeah.
And usually they'll come back, and we'll do some assignments every week like that. It's just building their confidence that these scary things are all kind of in your head.
Yeah.
Right? And once you get on a roll and you start to see that you have contributions to make and that people appreciate your contributions, it gets easier and easier for you to build your confidence.
Yeah.
So,
so it sounds like y'all have done a great job, kind of transitioning from Kimberly-Clark to Halyard and building a very diverse team. And we've talked about in separate conversations that you've been pleased with the diversity and kind of the number of women that you see. As you talk to your colleagues around Halyard, what have you heard of the value of those diverse teams?
Yeah, it's been really exciting, and Shammy leads our innovation team, and I spoke that night at the leadership award night how I showed up at one of the innovation downloads of what the team was working on, and there were more women sitting at the table, women scientists sitting at the table than men, and I was like, oh, this is good, right?
Yeah.
And I had not ever seen anything like that. It was just stark to me.
Mm-hmm.
And so I was asking Shammy, I said, how come you have so many women on your team?
Mm-hmm.
He's like, well, because they're great. And I
Yeah.
said, well, how are they great? And he says, well, the diversity, and he believes in diversity, as do I, and just the difference of thinking
Yeah.
of people. It's you get a lot better solution if you have a lot of different people looking at something in a different, like with a different lens. But he was talking, he said, men, there'll be a problem, and they'll say, oh, there's that problem, I'm going to fix that problem. They get hyper-focused on fixing whatever it is that's broke. And that he finds that the women on his team think kind of more wholeheartedly or broadly about it. Like, so what caused this? Why did it happen? Why do we have a problem? And let's tear it apart and go backwards and then come forward. And with those two combinations together, that's diversity of thinking.
Yeah.
And you don't miss anything.
Right.
And it makes it go faster.
Right.
Right. So, and it makes it so you don't do it again.
Right.
And create another problem.
But you get better products from it.
Totally
and
better products.
Ultimately, the patient benefits from that.
Yeah.
And that's what we're all here to do, I think.
Yep.
Right.
And
so,
women have pretty good instincts about nurturing of patients.
Yeah.
Which I think that they can bring that perspective as well, which is that patient focus that we kind of talked about a little bit.
Well, because I say, I've said it before, the people, who are listening have heard me say it, and I'll continue to say it, that this diversity thing, it's not a chick problem. It's not a chick thing.
No.
It's an everybody thing. And it's not about the girls show. It's really how do we build diverse teams, gender, culture, thinking, particularly in this industry, and particularly as you mentioned, we've got this shift to consumers. And so if we're all thinking the same way, there's a huge missed opportunity from an economic standpoint, from a patient benefit standpoint, from a system as a whole standpoint. And that's kind of part of the whole thing with Medtech Women is how do we start to build a pipeline of the next generation of executive leadership so we can have really diverse C-suite in Medtech and very diverse board of directors to the chairman level in Medtech. And I think we have a unique opportunity to start doing that in the Southeast, and it's great that Halyard's a really good model to follow on that. So on that note, how do you think as an industry as a whole, not just limited to the Southeast, but globally, how do we start building a pipeline of that next generation of leaders? So obviously it's not just about hiring diverse people, more women and minorities from different backgrounds. It's how do you got to develop those people, right?
You have to develop those people and be open to developing those people because they're going to be different than you are, and it's hard to get started because do you start with industry and say industry you have to hire diverse people?
Right.
Well, that's only one piece of the puzzle because then on the other end you have to make it so that diverse people want to work in your industry.
Yeah.
And that it's appealing to them and that they're treated well and that women are accepted or minorities are accepted, different opinions are accepted. And that's culture in an organization. So I don't think you can change it all.
Yeah.
I think that we need to have more women leaders to get there. And part of that is because we're going to have to, and women and other minority leaders, because they're going to be the ones that drive the openness.
Right.
That's going to need to happen.
Right.
And that the other piece of it is organizations really trying to change their culture to a more open, candor, but respectful workplace. And those are big issues that have to come from the top. So
Yeah.
I think we've got to continue to get more and more leadership at the table to make those big changes happen.
Yeah.
In the meantime, I think everyone needs to help people out one at a time.
Yeah.
And so I mentor a lot of women. I have great passion about it, because I wish I would have had more mentorship.
Mhm.
I would have probably been less afraid sometimes, just having someone be supportive. And I always say, when I start, I say, I'll invest time in you because I believe in you and your skills and the way you think. I mean, I don't just pick anyone. I like to talented women, but I always say you must pick someone. When you sail, you must pick someone that you mentor, and that we have to continue to build on that. And women specifically don't do a really good job of that.
Yeah. Interesting. No, they don't. They don't. And I think you and I have both lived through a lot of that.
Yep.
So I know we just have a few minutes left. Any kind of final words of wisdom or advice for, it doesn't have to be necessarily, women in medtech focus, but it's an exciting time in the industry all around.
Yeah.
Any words of wisdom for innovators or younger folks wanting to get engaged in this industry?
Yeah, I'm going to give my typical speech, and it's really it's how I mentor folks, and that is you've got to run your own race. So you got to know what you're good at. You got to show up every day, and you got to be passionate about what you're doing, and you got to stay committed and focused. And you got to worry about what you're doing, not what 1,000 other people are doing. And then you need to help everyone else with their race too. And when you do that, I promise that you're going to get to the finish line in really, really good shape. Because we're in such a great industry with such amazing purpose that really anytime you're helping everyone else do what they need to do too, you're all winning at the end of the day. But it's my biggest career advice. And so I'll finish on that.
Super. Thank you so much for your time and sharing your wisdom and insight today. I really appreciate it.
Thank you.
Thanks everyone for joining us. And again, please join us in Greenville, South Carolina, May 2nd through the 4th. And we look forward to seeing you at the next webinar.